condition and only authority to authorize non-intrusive medical care, such as taking oral medications. You cannot use the LPS law to authorize intrusive treatment or surgery. You usually have to go back to court to get that authority, and the court has to determine that your loved one lacks the capacity to consent. So just making a comment around that. And then I think too, because I think I saw some questions around treatment. You know, you can get the power to involuntarily place your loved one in a locked setting, and you can get the power to involuntarily medicate. But let me be, honest around treatment, right? If your loved one is in an unlocked setting or even in an IMD, the facility is generally not going to force medication. So where we see the forcible administration of medication, so the shot in the arm by force, usually is occurring in the acute setting because they have the mechanisms, the facility, and the ability to do the doctor's orders and do that in the appropriate setting. There are a lot of rules and regulations around forcibly administering medication. So I want everyone to be real clear that even though you have power, you have authority, that doesn't necessarily mean that's going to happen. So, and even for our conserved clients, if they're refusing to take their medication after conservatorship, we're going to work with the doctor around and the treating staff or whoever's working with that client. How can we engage that client to get them to comply with medication? But if they don't, and they need to be administered something because they're decompensating, generally that has to happen in the acute hospital setting. Okay, next slide. LPS conservatorships last for only 1 year. They will expire automatically at the end of that year unless there is another petition for reappointment. So you can renew that on an annual basis. So prior to the expiration of the conservatorship, the treating doctor needs to evaluate whether or not your loved one is still gravely disabled, and declarations need to be completed and filed with the court. So public guardian will do that through our counsel. If you're the private conservator, you're responsible for filing that. So public guardian starts the process, right? We're the only one that can initiate the petition, but if a family member is appointed or someone else is appointed, you can reestablish it on an annual basis. You would be the one required to go in and do that court process going forward. Next slide. Public guardian is going to terminate the conservatorship when the client's found by the treating psychiatrist or public guardian to no longer be gravely disabled. If the client's whereabouts are unknown for 60 days. Private conservators, if your reappointment is not filed, it terminates by operation of law automatically. And upon conservatorship termination, whether you're the public guardian or the private conservator, your powers cease. So you no longer have any power. If the conservatorship terminates and your loved one needs conservatorship again, we have to start the process all over again. So one of the things that we always talk about with family is, don't terminate the conservatorship if the doctor is still recommending it. Please reappoint that conservatorship. But if you and the clinical team all decide that it's the right thing to do to not move forward with the conservatorship, by all means, you should not conserve someone who does not meet criteria. But recognize that if they get off conservatorship, there is no process to just immediately put them back on. We have to start the process all over again. And for most of you, that would mean the traditional route and getting them hospitalized and getting referred. Next slide. Let me tell you a little bit of outcomes really quickly because my time is almost up, but let me just get you a few things about how our pilot is working. So we have done investigations on the street. A couple of our clients have gone into the acute hospital, and we've done a few investigations in the hospital. We've had a mix of temporary conservatorships or going straight to the permanent petition, and we've had a mix of submissions and court trials. Next slide. So here's our current statistics, and these are current as of yesterday, I believe. So we've had 10 official referrals from the home team to the public guardian's office. Now, I'm going to remind you, that may sound like not many, but we've only been operational since July, and actually only since August. So this is we've done an incredible amount of work in 6 months. So we've had 10 official referrals come into our office. Public Guardian has recommended yes to conservatorship on 7 of those. 4 of those conservatorships have in fact been established, and 3 of them are either pending the filing of the petition because we're still working out placement, or we have some pending hearings coming up. We have 1 active pending investigation going on, and there were 2 cases that at the end of the day, we did not move forward on. One of the clients ended up voluntarily engaging in treatment, and the other one we determined was not gravely disabled at the time. Next slide. Now, even though we've had 10 official referrals, we have some other cases that we've been talking about. So we have weekly meetings and cases being presented. So we have 4 cases that have been additional cases that have been discussed but not referred. And in these discussions, we're kind of finding out there's maybe the need for more engagement by the home team, or some of those alternatives that we talked about have not been tried, FSP, AOT, and the home team's going to circle back to see if any of those situations may work out, may pan out. They may not. We may ending up taking these cases in the end, but we're still working through those. There are 4 additional home cases that ended up actually being hospitalized because they were acutely ill, and the hospital ended up referring before the home team could make the referral. So they are in our home pilot. They've come in the traditional route, but we're looking to get them out of the hospital as soon as possible and have them be part of the home process. So, in totality, we have been dealing with a lot of cases in 6 months. Next slide. So lessons being learned, and this is an ongoing learning of lessons, and we have ongoing challenges. So this is a time-intensive process, no doubt about it. There is the need for a strong team, the home team, the public guardian working together, along with our intensive care division, our partners, the acute hospitals, the facilities, our housing program. We have a huge amount of people involved on our weekly meetings working through these cases. So this is very time intensive. We need a strong team. Placement continues to be our biggest challenge in terms of getting facilities to be willing, being able to get people out of the hospital as quickly as possible. And then the issues, things that we didn't really even think about that we need to address. Before anyone can go into a placement, they have to be medically cleared. And how are you going to medically clear them? That usually, can you get them to take lab work on the street? Do we have to take them to a clinic or a hospital to get that done? Will they comply? Law enforcement cooperation. So Jim kind of brought up some of the challenges right now. Most law enforcement officers currently have directives that they cannot lay hands on individuals who have mental health disorders, to force them into ambulances and things of that nature. So that's an ongoing challenge that we have. And then there's the fact that we need everything. We need more of everything. Psychiatrists, public guardian staff, county council staff, and housing. That we're learning. It's very intensive, and you need a strong team. And then COVID, and I don't have it on here, but oh my gosh, COVID is just layering issues upon issues for us to be able to get things done, because right now the hospitals are really concentrated on dealing with COVID patients. Can it be done? It can. And obviously we've done it. We've got some success in getting people conserved. Next slide. Mental health court, Gail told you where our mental health court is. Please note that right now, nobody is going into the court because of COVID orders. The court clerk's office is not open to the public. You have to use a drop box to drop off anything. Court is discouraging, actually prohibiting any personal appearances, and we're using WebEx. I will state that WebEx has probably been what has been beneficial in our home pilots, because one of the concerns we had was how were we going to get homeless individuals who are resisting and refusing services into the court. And so we've been trying, and we're, we've only had a couple of cases, but, actually getting them on WebEx on a laptop on the streets. It's a whole new thing, and we're working it out case by case, but it's actually proving to probably be a little bit helpful in our home pilot as we go forward with this. Next slide. That's just contact information. So I've given you, if you have someone who's on conservatorship with the public guardian's office and you have some concerns or want to talk to our manager, that's Marie Guillaume. She's the assistant division chief for our caseload. Louis Leyva is our assistant division chief for investigation. So anybody that's been referred to our office. Steve Dominguez is the next layer up in terms of our division chief. In terms of our outpatient, Isidro Alvarez is the deputy assigned to our outpatient pilot, and Luis Berrizabal is his super. I believe that is it. And I only went 3 minutes over, Gail. You're on mute, Gail.
Sorry. You did a great job. Thank you so much for doing this. Are there questions? I'm sure they are. Araceli? Hello?
Yes.
Do you want to, if people have questions, do you want to take them between Jim, Connie, and I? We can answer them at this time before Dr. Sharon comes on.
Okay. Yes, I see. And I see Pam has unmuted themselves too. But this is the time. Just raise your hand and I can unmute you. So Pam, you are unmuted. You may go first.
I'm sorry, maybe I'm slow, but I have a son who's currently in the Twin Tower Jail mental health tower. He's been arrested 40 times. He has schizoaffective disorder. He was allowed into the AOT program, but then discharged when one of the times he was arrested. Then we tried to get him into, there was another program, AOT, because he didn't qualify again. I forget, trying to find a home, but